Epileptic seizures are actually common. Your chance of having at least one epileptic seizure if you live a normal lifespan is 1 in 10. But only a third of people who have one seizure will go on to develop epilepsy, which is a condition of repeated seizures.
The problem of epilepsy is a combination of two elements. One is that seizures will cause a loss of consciousness or an impairment of awareness, or something that will interfere with a person's ability to take care of what they're doing or take care of themselves in a safe way. The other part is the fact that the seizures occur at unpredictable times.
So some types of seizures are actually life-threatening. Most of them are disabling, often because they occur without warning. So patients can't drive a car, can't operate heavy equipment. If it happens at the top of the stairs, they might fall down the stairs and injure themselves. So it's a serious condition.
I think it's very important to be aware that epilepsy is a common disorder. If you look at some earlier statistics, it's as common as breast cancer in women, lung cancer in men.
And among patients with primary diseases of the brain, it's equivalent to depression, to dementia, and to substance abuse.
The treatment for epilepsy starts with medications. The medications differ in how well they work for individuals, and they also differ in their side effects. And so finding the right medication for the person is really important. But what we have now, especially in the era of neuroscience in which we're living, are options other than medications. We have better understanding of the benefits of certain diet towards seizure control. We're understanding better the toll of seizures and epilepsy on emotional health and the benefits of improved emotional health toward controlling epilepsy better. And also devices, electronic devices, implantable devices that can produce better seizure control for many patients. And so there are options beyond what was routine.
There's laser surgery rather than open surgery. There's also neuromodulation. Neuromodulation means stimulation that prevents the seizures from occurring. So there's vagus stimulation, which just stimulates a nerve in the neck. Or there's stimulation directly into the brain called deep brain stimulation, or DBS, that goes continuously. But the most interesting and most effective now is what's called response neurostimulation, where when the seizures are coming from an area of the brain that can't be easily resected, you can put an electrode into that area, and you can embed a little computer into the skull, and that computer will detect when the seizure begins, stimulate it, and stop it.
What's been really exciting is that these devices now afford the opportunity of opening a window to the brain so we can actually monitor in an outpatient setting actual brain waves and have individualized treatment going into these specific patterns of this patient's brain waves and tailor it to provide stimulation. UCLA has been in the forefront of research in this field. We have one of the largest numbers of patients with responsive neurostimulation. As the local principal investigator here at UCLA, following up on these patients, we're the largest recruiter, and we have shown that a lot of these patients have a 75% reduction of the median frequency of seizures. And what we found in all the devices is that there is a significant reduction in the risk of death from epilepsy with these devices.
Beyond understanding the anatomy of epilepsy, we're also entering a world where we're understanding better the timing of seizures. Part of the problem with epilepsy is not knowing when the next seizure is going to occur. If we can understand from these patterns times of greater risk or lower risk, that's useful. It's a way of a person preparing for what might be something that they don't want to happen, or relaxing because of some confidence that that is lower risk. And so we're working in the direction of both the structure of the brain and connections, as well as the timing of seizures, and the connections across time that's relevant.